Good day, learners. Welcome to our subject in PLEA. This lesson will be your third quarter in week 7 and 8. Learning outcomes. At the end of this lesson, you are expected to do the following. L1. Identify nail structure and shapes. And LO2. Create basic nail design. Before we start off, let's have an agreement first. Be a good listener, and if you like to become a good listener, only your eyes and ears open. Okay, let's move on to basic information about nail. Nail is a plate of keratin that lies on the tips of the fingers and toes. The main purpose of the nail is to protect the fingers and toes. However, the fingernail also assists with certain physical activities in daily life. The image below are the diagrams of the nail and its structure. We have the lineola, cuticle, body of nail, free edge of nail, nail matrix, root of nail, cuticle, lineola, nail bed, body of nail, free edge of nail, and bone of fingertip. As you can see in the pictures in the previous slides, the first structures of nail is the lineola. Lineola is the pearly colored and crescent shape is due to the cells being pushed closely together. The blood capillaries cannot be seen through the lineola because of this. Second, we have the cuticle, the overlapping epidermis around the nail. It is the transparent skin which is called the true cuticle that is removed during the manicuring process. Third, we have the free edge, the part of the nail that can be filled and shaped. It is an extension of the nail plate that overlaps the hyponychium. Next, we have the matrix. Matrix is the only living reproducing part of the nail. This is situated directly below the cuticle. New cells form here and continually push towards to produce the nail plate. It also contains blood vessels and nerves. Then we have nail bed, the part of the nail where the nail plates rest on. Also a continuation of the matrix. It is abundantly supplied with blood vessels and nerves, having numerous parallel ridges which dovetail exactly with the ridges on the under surface of the nail plate. Next, we have the nail walls. Nail walls, the folds of skin that overlap the sides of the nail. They hold your nail in place and protect the nail plate edges. Nail plate. Nail plate is visible nail that rests on the nail bed up to the pre-edge. This is made up from dead cells and minimum amount of moisture. The nail is semi-transparent, allowing the color of blood supply of the dermis to show. Okay, let's move on to shapes of nail. The shape of nail conforms to that of fingertips of an individual, as you can see the pictures below. The first shapes of nails, we have the oval nail. This is common among people with long, perfect nail beds. It may be styled slightly rounded at the base and slightly pointed at the fingertips. Most often, this type of nail has a natural look and looks very good in short, medium length. Number 2, we have the round nail. Ideal for shorter nails, the nail is allowed to grow out straight at the sides for approximately 1.5 mm, and then the tip is filled into a rounded shape. This is a strong shape which is great for those who keep their nails short. Number 3, stiletto or pointed nail. Filled away at the sides to a point at the tip. This shape is very weak as the sides of the nail, which provide the strength, are totally lost. Then, next we have the squabble, as above, but followed by squaring off the tip. This gives the nail tip strength over the oval shape. And lastly, we have the square nail. The square-shaped nails are the most famous among the nail shapes. It is created by allowing the nail to grow out straight and then filling the tip straight across the right angles with the rest of the nail plate. Okay, those are the different types of shapes of nail. Nail diseases and disorders. Nail diseases are conditions of both the nail and then the surrounding skin which result from bacterial, fungal, and viral infections. Some conditions will show a green, yellow, or black discoloration of the nail, depending on the nature of the infection. The main cause for infection is through damaged cuticles and broken skin. Given below is a list of the few important nail diseases and disorders and their characteristics. The first nail disorders and characteristics, we have the blue nails. It is a bluish in color, may be attributed to poor blood circulation or heart disorder. As you can see the pictures. Next, we have the brittle nails. It is a vertical splitting or separation of the nail plate layers at the distal free edge of the nail plate. Overexposure to detergent soap and other chemical solvents may attribute to the effect, as you can see the pictures. Next, we have the bruised nails. It shows dark purplish, almost black or brown spots in the nail. This is usually due to injury and bleeding of the nail bed. As the nail grows, dried blood in the nail bed will also go out. Next, we have number 4. We have the eggshell nails. The nail plate separates from the nail bed and curves at the free edge. It may be caused by chronic illness of the systemic or nervous origin, as you can see the first image. Number 5, we have furrows. These are long ridges that run either lengthwise or across the nail. Some lengthwise ridges are normal in adults. These ridges increase with age and can also be caused by psoriasis, pulse, poor circulation, and frostbite. Ridges that run across the nail are caused by high fevers, pregnancy, and measles, as you can see the second image. Number 6, you have hangnails. It is a condition which the cuticle splits around the nail. Carelessness in removing the cuticle. Dryness, cutting off too much may result in hangnails. It may cause infection if not treated. As you can see the pictures in the third image. Next, you have leukonychia or white spot. White spot appears frequently in the nails. They may be caused by injury to the base of the nail. As the nail continues to grow, these white spots eventually disappear, as you can see the pictures in first image. Next, number 8, we have the perigium. It is an overgrowth of cuticle which sticks to the surfaces of nail plate. Carefully remove the adhering growth by means of a cuticle nipper, as you can see the second image. Number 9, we have the onychotropia. It is described as wasting away of the nail. The nail loses its luster, strength, and falls. This can be caused by injury to the nail matrix or by internal diseases. As you can see the third image, that is the onychotropia. Number 10, we have the onychosis or hypertrophy. It is, it is an overgrowth of the nail, usually in thickness rather than length. It is caused by an internal imbalance such as local infection or heredity. As you can see the first image, that is the example of hypertrophy. Number 11, we have onychophagy or beating nail. It is an deformity of nail plate caused by beating nails. It is an acquired nervous habit which prompts the individual to chew the nail or the hardened cuticle. As you can see the second image, that is the example of beating nail. Number 12, we have the onychorrhizitis or split or brittle nails. It refers to split or brittle nails caused by an injury to the finger, careless filling of the nails, excessive use of cuticle solvents, and nail polish removers. The nails may be extremely dry because of some granular disorder. As you can see the third image. Number 13. We have the ridges. It is caused by uneven growth of the nails, usually resulting from illness. Wiping the nails with paste polish will help remove ridges. Number 14. Treating cuts. It is caused by an accident during manicure service. Apply an antiseptic immediately. Do not apply nail polish on the affected area. So as you can see the second image. There are 6 nail diseases and their characteristics. The first one, we have onychomycosis. It is an infectious disease caused by a vegetable parasite. The onset of the disease takes about 2 to 3 months and the attack is rarely on more than 1 or 2 nails. The appearance of the nail is sprayed, brittle with furrowed surface, opaque, grayish or yellowish in color and is lifted up by an accumulation of epidermis underneath, as you can see in the first image. Second, we have the onychia. Onychia is a term applicable to chronic inflammation of the nail fold and nail bed matrix. It results from the introduction of microscopic pathogen through small wounds. As you can see the second image, that is the example of onychia. Number 4, we have the onychorrhapsis. It is referred to ingrown nails which affect the fingers and toenails. It is marked by nail growth into surrounding tissues and may cause infection. Incorrect trimming and shaping of nails are often responsible for ingrown nails. As you can see the first image, that is the example of the onychorrhapsis. Number 4, we have onychoptusis. It is the periodic shedding of one or more nails, either in the whole or in part. This condition may be a symptom of a more alarming diseases such as syphilis or can result from fever, trauma, systematic upset, or adverse reaction to drugs. Next, we have the onycholysis. It refers to the detachment of the nail from the nail bed, starting at its distal and or lateral attachment. The most common cause of the onycholysis is psoriasis, as you can see the third image. And lastly, we have the onychogryposis or claw nails. It pertains to extreme thickening curvature of the nails. Usually, it is caused by varying degree of hyperkeratosis, skin diseases in which the skin gets thicker on the distal portion of the nail bed that detaches and left the plate of the bed. As you can see the pictures below, that is the example of the claw nails. Okay, that's all for today. If you have any questions, clarifications, you can contact my cell phone number 0926994824. Again, 0926994824. for your activity answers, just visit our guide if linked below. Okay, thank you for listening, and once again, good morning.